but I am an ophthalmologist and head of the department at Ahmedabad Medical College and Jinnah Hospital. I also run a private center, a Fees Eye Center, where we provide specialized eye services. My question to Professor Sarwat is that I have read your brochure and all the literature that you have distributed. How do you plan to convert this mission and vision into practical application into all hospitals and healthcare institutions in Pakistan, because you have plans to expand it to Southeast Asia and Middle East and other countries. But listening to your presentation, I could not make up that practically what are you going to do?
Thank you. That's actually a very good question, and it's a good question, except my microphone is not working.
But your voice is quite loud.
Okay, thank you for your question, Professor Saab. First of all, in fact, I work in Boston, but I heard your name there. MashaAllah, you're doing a great job, great work. Basically, it's the question of capacity building. When we have started with experts, some of them are sitting here on the desk, and some are organizing. We are going to train two kinds of people. One are the auditors, who are going to audit the institution against the Punjab Healthcare Quality Commission or Provincial Healthcare Quality Commission in all three provinces where healthcare quality commissions exist. So the auditors will go and audit and find the gap between where they should be and where they are, and prepare a plan of intervention and action. And then, in addition to auditors, we are training, already have trainers who are going to go and train the staff of the institution or the department to understand and change behavior and attitude based on what is required to be done. For example, मैंने अर्ज किया था कि everybody knows how to do the right thing, but for people to get to do the right thing all the time requires training. So we are increase the capacity of healthcare quality improvement by full-time and part-time staff, and we're hoping जब किसी institution में जाएंगे, वहाँ training करेंगे, some people who are interested to join us in this work of healthcare quality improvement, of course they will be paid for their money as we will be charging the institution. Then gradually our circle of experts will increase in every large city and hopefully in smaller cities also. And we will provide them the material and they will spread the word. Similarly, there is a great need for healthcare quality in the Middle East, in the Southeast Asia, and in Africa especially. And I've been to Africa from my university for volunteer work, and to the Middle East also. So I kind of know a little bit about how things work in those parts of the world. So this is how we're going to do it. So basically, it's the increasing the capacity, which will then spread the knowledge and impart the skills.
So this is your focus on the human resource only. What about the infrastructure?
Okay, very good. Now, very good question. The infrastructure, if you notice that one of the fundamentals of healthcare quality improvement is commitment by leadership. Unless there is commitment by leadership, you cannot change the system. And the commitment of the leadership starts from the minister, the prime minister, and the government level, so that they will be forced to increase the healthcare budget when everybody gets together and raise their voice for the needs. 0.6%, I think, or 0.9%, less than 1% of national budget is spent on health. I think we probably have spent more on many other aspects of society than we are spending on health. Just as an example, America spends 14% of their GDP on health, 14, and we spend less than 1%. and imagine America's budget and imagine Pakistan's budget in real terms, how much there is, irrespective of the percentage. So all other nations, I think amongst the top 10 nations, the least amount of money someone spends is 9%. And so with this movement of need for quality also includes patient education, patients' rights, so that healthcare quality or healthcare needs become the topic, agenda of discussion, national discussion, rather than agenda of after-dinner discussion, or rather than His Excellency, Honorable His Lordship, the Chief Justice of Pakistan, going and doing his intervention by telling people they are doing wrong. They are doing wrong, but there is a whole list of things that need to be done in order to correct. And I think that's a good beginning for the agenda of healthcare quality. Patience is important in this because this thing is not, as I said, is not going to change in the lifetime of those who are graduates of before 1975. I wouldn't say everybody. But I think once you start the movement, the younger people over there are going to take up and become a national agenda. I know it seems impossible, and actually to us also it seemed impossible, but what do you do? If an impossible task, unless you try to tackle it, unless you take the first step, it's always going to be ignored. And the absence of quality hits home then when my relative dies because of absence of proper quality. That's when it hits home.